I don't know how many people have attended Zoom, but if you move your cursor around a little bit at the bottom, you can see the chat and you can ask questions. I'm going to do a lot of those at the end because the video is really jam-packed full of information for you. And on the last one, most of the questions were already answered. I didn't really get that many, which was great. I try to keep this to about an hour. And what you're going to see is about 27 minutes or so of pre-taped live treatments. So that's really nice because I kind of took things out that were maybe gone over too many times and things like that. One thing that ended up being eliminated from it, unfortunately, is the tools that I use. So I kind of wanted to go over the fact that they are bought in the US. They are one per patient, because I've had that question several times. So the microblading is done by hand. It's a little fish stick and the little needle hooks into the end, and you'll see live how I'm making the little lines of hairs and ink in your skin and things like that. And I'll explain why I'm doing it that way, how it's working. You can listen kind of to how the model that I used is, it'll be her third time having it done. So you'll be able to see the nice ink that is not in her skin anymore. It doesn't look like a dark, dried out, gray, old tattoo, which is really wonderful. So you'll be able to look at some of those things, ask some questions at the end. So eyeliner is done, it can be done by hand. It takes quite long, but we could do it. It's done more with a power tool. And so this is actually plugged into something in the wall, and the end of the needle oscillates up and down. And so when I'm grabbing the ink into one of these needles, it's moving into your skin freely and kind of stacking or layering itself in there. So the tattoos are going to last longer, similar to the ones on your body. Where the microblading fades much faster, usually in a darker shade, a medium shade. You get about a year, year and a half if you're really careful with it, if you're not in the sun, if you're not swimming in the chlorine face first and things like that. So those are some of the things that were eliminated in the video that I kind of wanted to show you. One of the questions that I had on the last one was about lip blushing. I am looking into that. It's a different handpiece for the device that I already have. I just honestly haven't had the time to do it. I was going to do it when I was on vacation last week and I didn't get a chance. So I'm going to reach out to that company and see if I can get that ordered. Blushing is just a different technique. It's a little bit easier of a way to do a lip. We do the lips as well. I've done more of them for like somebody who's had a cleft palate and things like that, that needed to have the lip filled, and then she just didn't have any lip definition at all on one side. Some of the people that I've done for correction and things like that. And then other people just throw lip gloss on and we do a nice little pink. So today you're mainly going to hear about the blading. You're going to see live eyeliner. So we're going to play the video here. Nina's going to help me get this started. And at the end, you're going to see before and afters that you can ask me questions about.
First of all, I'm going to thank you for coming today. I really, really appreciate you always being around to be one of my little trusted models, which is awesome. So the first thing we're going to do is we're going to act like you never had permanent makeup before. And we're going to do that mainly because some of the people that are tuning in have never had it. They're super nervous about it and they don't want something to look overdone. And that was exactly the exact things that you said to me. I love my brows, I love my eyes, I love everything about my face, but I horseback ride, I'm athletic, I don't want my makeup to run down my face, and I want to be able to keep my nice eyebrows that I have. I'm young, so I always love to keep people's eyebrows where they belong, and you and I talked about that, and yours are super awesome, that you take very good care of them because you're an esthetician, right? And so what's great about it is that we can keep those brows the way that the direction that they're growing and everything, right? So we talked about way back when we did you were pretty young, and we first did it, and we didn't do a lot of that mapping and all of that modeling. You have really, really great brows that we could just follow. So I always tease you and say yours are kind of cheating, but as you age, they're gonna go away, right? So can you remember what some of the questions were that you had, or any worries that you had when you were brand new? Anything you can tell someone that would be important for them to know?
I think the first question was, is it going to hurt to have it done?
Okay, yep, that's a good one.
You talked me through the numbing process.
Right, so the numbing process is very good. So that is something we use 24/7 on top of your brows. and then we use something that's ophthalmically okay for the eyeliner. And they're two very different things, but they work really, really well. So would you say it was a comfortable procedure?
Yeah.
Yeah. I don't really get a lot of complaints, thank God. Sometimes right in the very beginning, it might hurt just a little until the numbing
Tiny bit pinchy, if I remember. Yeah.
gets in the skin, but then you're fine. So some of the ones that we can use when your skin is open is really, really great. So I send you home with the appropriate things that you need to take care of it. Did you find it was difficult?
Not at all.
Okay.
Very easy.
How did you heal? Scabbing?
No scabbing.
No scabbing. That's because you took care of it properly.
Follow the directions.
Yep. So you need to do all those things, and it makes a big difference. It'll give you more longevity, okay? So one of the other things that we want to talk about is the fact that the last time we did your brows was quite a bit ago. So the photographers are going to get some really good pictures to show people in a little bit of how that ink faded. It's a very big pet peeve of mine. I love that yours have faded more to a natural tone, and you have beautiful dark hair. So in theory, you would think that a dark color would go to that weird gray, something would be off, and for you, it is not. I can put a beautiful brown over top, and your brows are going to be great. Your eyeliner has also not faded to gray. It still is a very nice color. It's not a seafoam green. Sometimes these colors tend to really absorb in the body very weird. So I'm very particular about the ink I use, and I've used it for more than 20 years, and I think people are really happy with that. So that's something that I take a lot of pride in. So anything else you can think that we might want to tell someone that's new that we don't want to miss? I think we can...
No,
Not really. I think that's really it. Pain and
everything as we went step by step.
okay. Okay. So now we're going to go back to the fact that it's really today, right? And you are coming back. We're going to do a little bit of letting you hold the mirror. We're going to talk about the placement of your brows. You had said something to me that when they are kind of coming down a little bit in this area, you feel like you've got a little spot missing there.
Just a little hollow right there.
Yep,
Yeah.
so we're going to work on that. We're going to work on that peak. Nobody ever wants to lose the beautiful rooftop. And then some of this little bit on the side, and definitely some there in the front.
Right.
So the other thing that we're very careful with, especially with me, is that we don't make a big giant squared off check mark. Those things don't stay in style. So if you want to do that some night, you've got a giant after 5 event and you really want to rock the brows and do big hair and all of that, you can do it, yep, and then it washes off. So that's something that I'm really particular about. Yours are super even, which is really wonderful. You're still very young, so you're still cheating. But as we age, usually one of our ocular areas wants to tip a little bit. And when that happens, we're going to need to see the physicians, the physician assistants, things like that, for Botox to keep our eyes where we want them to be. We don't really want to continue to change the shape of the brow and the width of the brow with a bunch of mapping and keep making it thicker and thicker and thicker, because at some point one side is going to be thicker than the other. So that's another thing that I kind of vary from with other artists, is I try to make sure that they're for your face. Everybody's eyebrows don't look the same. We're going to see some more photos as they come through this webinar a little bit, which will be really good for people to see. Some patients have none, and we can play with that a little bit, but keeping your eyebrows where God put them is the best thing to do. And if you want a facelift later in life, your brows are going to be where a surgeon would have to work with them anyway, right? So that's been the easiest. So we're going to work on those areas you don't like. Another thing that I love to do with my patients is I give you a mirror throughout. So we're going to be able to see this as we're treating you in a few minutes. We wipe the ink away after it's underneath the Vaseline or the plastic, and we know then where the ink is, how it's looking, and you can really make some determinations on your own. I love to use your guys' opinion because you know the way that you want to look, and you know what bugs you. So if those little things are gone, then we know we're on the right track. And then how has the eyeliner been? I know you like it thinner to the nose. Yes, a little thicker on the outer, right? And do you want that changed at all?
I feel like it's just kind of faded.
A little of the color?
Yeah, faded a little bit, and then just in general, I just don't see it anymore.
Okay. And I can't remember, forgive me, did we do the bottom? I can't remember. We only have done the tops. Okay.
Yep.
And you can always just kind of, you can change that if you want. Some people like the bottom to be like a lash enhancement, where we're almost like dotting along the bottom of those lash line. For you, you love concentrating on the top, which I think is beautiful. It opens your eyes so nicely. Your color was black orchid, so it's like a purple black, and a lot of people hear the word purple and they think, oh, purple adds that little bit of blue so that we don't get the graying effect of black. So I don't typically even buy black. Sometimes on African American patients, I might use it on their brows, or like the salt and pepper ladies that have the very super dark in their hair as well as white. The true black that can even want to go charcoalish, mahogany kind of thing, it really does well on that very fair, dark grade kind of patient. And for you, you wouldn't want that. So you have the beautiful brown eyes. I think that color stayed really well for you. So how many times have we done you now? I can't even remember. Will this be 3 maybe over the years?
It'll be the 3rd time.
Okay, so super happy you've done it, yes?
Yeah.
Okay, anything you want to say to anyone or what you wish you could get in about microblading or eyeliner or?
I think my being back speaks for itself.
Okay.
That, I mean, this is the 3rd time, and
Yeah.
I love it every time. I tell all my friends, I tell my clients.
Yeah,
And,
I appreciate that, thank you.
You've seen them too, so.
Yes, I have. I've been very lucky from you. I know, thank you. I really appreciate it. You're a little bird out there singing away.
That's right.
Yeah, which is great. So it's just good to have people happy about it. You don't sweat at makeup off with you doing horseback riding and being very busy, hot yoga, snowboarding. Yeah, you're a...
Cold, all the weather.
Everything does really well. All right, well, let's get started, okay? Okay. So we're just gonna start by cleaning, making sure the area is all prepared to be numbed. Again, up top here, we're gonna do some 23/7 as before. Numbing time typically takes about 20 to 30 minutes. You can get started on the eye faster because we have the numbing eye drops, and that numbs the mucous membrane of the eye. Little dots of you remember these sting just a smidgen. I know, sorry, scared you. Zap. It just scares you when it touches your eye. I know, I'm sorry, you're jumping, huh, there. So on the brow area, we're gonna go do a little bit of this 23/7. We're gonna get it worked in there really well. I'm gonna let it sit nice for you, and it'll start to take effect pretty quickly. We also can keep it activated by rubbing it a little bit this way. It kind of lets us cheat to make it work a little faster. Leslie and I spoke about the color. She'd like to go a little darker. Now that she's braver and has had this done before, she knows that it can fade, and she knows that she wants it to last a little longer. So she's asked me to pick a little bit of a darker shade this time. Her body and her face can support that because she has beautiful dark hair and dark brows, and so it will just blend very nicely into her skin. One thing I do want to show you is when you take a look underneath here, you don't see all that dark old ink. It's a little pink, it's a little bit red, but there's no dark old gray ink. You see her nice skin tone. So when I want to go in there with a nice dark shade and follow the direction of this hair growth, it's just going to look like she has more brows. They're going to be more defined, and you're not going to have a big dark heavy area that you have to work with. It's very, very important. All right, so here we're going to put this is what we use on the eye to numb there, and we're going to have it sit a little bit, and we are probably going to get started with the eyes first. Like I said previously, Leslie and I have spoke about the fact that the front of her brows go up. She has very small little brows here in the front, so we're going to do the strokes tiny as though they are mimicking her own brows. We're going to try to keep going the direction of the hair growth that she has naturally. Here you can see some of these top hairs want to grow down a little. So we're going in between those naturally, softly. This is an area that she always has to wear powder once her brows fade, and one of the main reasons she had originally wanted the microblading several years back. So we're just going to kind of follow the natural shape of the brow. We're going to make sure that everything falls into place with all of the natural hairs as much as possible. This actual pattern I don't do on every single person. Easier to do on someone who has nothing. Sometimes your brows just don't have this natural down and up fashion. You can try to build them that way, you can make them that way, but sometimes they look a little more unnatural to a patient who doesn't actually already have it. Leslie's very lucky that she has this actual growth pattern. Some people have a much finer, thinner one. Others have a curly one with almost a colic that you might see sometimes when someone's getting their hair done. We're going to grab a little more numbing now because her skin is open, and we're going to run it across, which is going to make the second pass much more comfortable for her. So again, you know, we are using a darker shade, we're using a very fine blade, and we're just softly going in between these brows to try to give her a little bit more definition and volume. She's going to need to wear Vaseline for the next 2 weeks, round the clock, to keep it nice and moist. You want a Vaseline sort of mimics itself like a little tiny Band-Aid over top. And that way we know that there's not going to be any scabbing, any flaking of the color. It's going to heal nice and even. You do wear bacitracin off of the very first 2 days, so you'll use it. She'll have a dose tonight, this evening, and tomorrow morning. The time of day that we're doing this is around 11 o'clock in the afternoon, so she'll leave with her bacitracin on, and then she'll apply 1 dose tonight before bed, Vaseline all the other times in between, because we don't want it to dry out after we've applied the bacitracin. We want to keep it nice and wet, like a little liquid Band-Aid over top of this, letting it heal nicely. That's what's going to prevent the flaking. Because this is all done by hand, it's extremely intricately fine in top of the skin, much different than the old tattoos were years back. These don't tend to be as powdered and layered in as deep. They're definitely precisely put in a nice small little area. So now what I do is I paint a bunch of the ink on. I'm going to leave this one sit. Sometimes I don't do this right away if your brows aren't as even. Leslie's, again, are extremely even. She is an esthetician. She's taken care of them for years and years and years. So her brows are kind of like cheating, but when they're done, they're really, really beautiful, and she loves that she doesn't have to do as much to them on a daily basis. So sometimes I leave this one just sort of bladed so I can look back and forth, but I already know her pattern is quite even. How are your eyes feeling? Okay? Okay. So now we're going to do the same thing. Her little chin's going to tilt towards me. Again, you're seeing these brows sort of swept up until they sort of get to this area. They're growing down. Here they're growing up. So you get some of that feathering that sometimes you see on Instagram and things like that. Leslie has this natural, so it doesn't look like somebody drew some strange feather on her face, because her body already has this shape, and we can just naturally make it look better and like she has more. So that's a really important thing. The shape of the feather isn't always supposed to be duplicated and replicated over and over and over if the patient doesn't have that on their face. Sometimes it just looks very unnatural. You might find that if you have tiny, soft little strokes that are a little more undeliberate, sort of just naturally in a shape that you can come up with, not so feathery, I think it looks much better on a patient who doesn't naturally have this down of the brow. Not everyone has it. So now we're going to put a nice thick layer of color and numbing, and it's going to sit for 10 or 15 minutes underneath her plastic wrap, and then I'm going to start on the eyes. I think your own body sort of needs to coagulate some of that ink down in. The cells will sort of crawl over top, hold that ink in, and the Saran wrap does really well for me because the blood comes up, the ink goes in, and I feel like it gives people more longevity of their color. So at the very end of the treatment, I leave that on quite long to really let your body absorb it in as much as you can. Our bodies are always trying to eliminate things, so sometimes when we get permanent makeup, your body's trying to fight it. Here you're going to see Leslie's old liner. It is not green, it's not gray, it's not strange. It just needs to be beautifully enhanced again. She likes it again a little thicker on the outer part. So Leslie, we're just going to start very lightly, nothing crazy, and I know it'll hurt just a little because we haven't had as much time to numb as we should have. I apologize again. You're being awesome for me. So we're going to follow that very little spot there along the edge of the lash line just to kind of get it started and open. The clear that's in the jar next to the ink is the numbing. It does work really, really well once we can get that into the skin. So I'm just sort of skimming along the top with a tiny little bit to kind of somewhat get this started. And then we're going to go ahead and start depositing more of the color. I also like to tell patients to tattoo from the very beginning eyelash, not all the way down to the tear duct here. So we try to go to the very last eyelash to the very last eyelash. I think it looks the most natural. And again, if you want to do the big heavy duty after 5 makeup some evening, you can certainly do that. Put it right over top and it'll look beautiful. So you can make it thicker, darker, wider for an after 5 evening. But on a regular day when she's out doing her snowboarding, her horses and all of those things, she doesn't have an overdone makeup look. So now we're just going to gently wipe this away. We're going to take a peek and we're going to see how she's doing. Taking a little bit of this numbing on a Q-tip again to run it across. It's going to keep making everything comfortable. And this same numbing is mixed in with this brown underneath of her plastic so that it's going to be pushing the numbing in the entire time I'm back here working on the liner. We're going to try to do another soft little pass. Again, we're just going to go along the lash line. Most of the time during these procedures, I do have people open their eyes partway through and tell me, how is it? Do we want it darker, thicker, wider, anything like that? You will be back in 4 to 6 weeks for a touch-up that's included in your initial visit. Most people tend to want something just a little bit darker, or they think it's, perfect. They don't want to do anything. I still encourage you to have your touch-up because it's a little bit more ink being deposited into the skin one more time to give it that nice longevity that everyone wants to have, have with this procedure. You want to make sure that even if you think the touch-up is perfect, I try to have people come back. They say, oh, I love it so much, I don't want to change it. It won't necessarily change it, but what it will do is just give you more longevity of that ink staying and you getting your money's worth out of laying here and going through being tattooed on your eyelid. So if you are a Latisse patient, I usually have you wait a good month or so. Latisse is wonderful, but it does make your lashes very vascular. It just makes the lash line area want to bruise a little bit. So I typically have you hold off on using your Latisse and your eyelash growing serum about a month prior to coming in and having this done. It just will make so that your eyes don't bruise. The take-home papers say that you can ice. Most people don't. Did you ice, Leslie? Okay. Basically, it's the bacitracin at night, bacitracin in the morning, and wearing your Vaseline for 2 solid weeks, making sure that it's as thick as it can be. Leslie also does power yoga. It's super hot in there. So she makes sure that everything that she touches is clean before she touches her face. She puts fresh Vaseline on when she gets home or in the car out of the studio. We've texted about that in the past just to make sure that when you're sweating and when your face is getting wet, let's say you're taking a shower and washing your hair and some of the soap and things like that are running over top of these tattoos, it's good to have a nice thick layer of Vaseline on so that the water just goes right over top. What you're keeping it sanitary with is going to be your bacitracin in the beginning, and then just not touching surfaces and touching the tattoos, and always making sure that what you're putting on is brand new. Use a brand new Vaseline that I give you, a brand new bacitracin that I give you. A lot of people tend to keep Vaseline in their homes too long, and we don't want to put that over top of a healing cut. So now we're going to take the plastic away for a little bit, and We're going to softly wipe the brows away. And Leslie, if you want, you can pull up the mirror so we can kind of talk about where we're at, what we're thinking. If your skin is extremely dry, sometimes it's going to stick a little bit to your skin. You see me wiping pretty aggressively here. I don't really want you doing that at home because you're going to be pulling some of those tiny little hairs away. I want you to wipe as softly as you can when you're taking the Vaseline off and applying new. So now that that's away, I'm going to take some more of the numbing and we're going to rub it through here. Make sure we get any of the leftover ink and let that sit for a moment while I wipe the other one so she can see this one too. And this was only one pass, so we definitely are going to need to do more. But what I think is nice about it, especially for someone who does not have brows, is you see me softly changing your face throughout the whole thing so that you're not as nervous when you just sit up and you're like, oh my goodness, I have eyebrows and I didn't have any before. So I think it's great that the patient gets to talk to me about what they normally do when they're drawing their brows in, or things that they're not able to do when they're drawing their brows in because someone else is doing it, and it's easier for somebody else to get to your face and do things to it from a makeup standpoint that we typically can't sometimes do to ourselves. Again, we're applying more numbing. So you see, even when I'm rolling this across, you're not seeing giant, big, dark, crazy hairs everywhere. There's not tons of ink. It's going to look natural and beautiful like her normal brows are. We just want to keep enhancing. So when you see, Leslie, what are we thinking? What's your thoughts that you're seeing that you like?
I'm already not seeing that hole.
Yep, I really worked on that.
Yeah.
That was the first thing I wanted to eliminate because that bugged you the most. Mm-hmm. So then what we can do is kind of work on some of these other ones that tend to want to just open.
Yeah.
And they are going to look a little more pronounced now because your skin is starting to blanch. You see that white. So that means, thank goodness, that you're more numb this go around. I know you won't have to be angry with me. See, you were a little trooper. So this one could stand to be a little bit more, put together like that one is.
And I always notice right where
right
you
in there.
Yeah.
Mm-hmm. Yep, you're going to need some there. So I think we're on the right track. We might pull one or two of those. I don't know if they need it.
I know. I just left them because
That's
I don't
okay.
know what to do with those yet.
That's okay. And we make that determination as we go along. I don't typically just start tweezing someone's eyebrows without asking and making sure that you're comfortable with what I'm doing.
Yeah. Where's your little stick?
Right here.
Thank you.
Mm-hmm.
See that one weird
Yep.
eyebrow there?
Okay.
That's kind of been my guide.
Okay.
I would pull it if I had a line just under it,
Mm-hmm.
but since I don't, I've been leaving it.
Okay.
So that's kind of where.
So we'll just sort of make a few along in there too.
Mhm.
Mm-hmm. Okay. Perfect. So now that we've talked about that, we're going to tilt our chin back up towards Jill. Maybe just a little on that outer end.
Look at it.
How are you
yeah.
feeling about the nose? That part I think is pretty good.
No, I think that looks good.
Okay.
I like how it tapers really,
Okay.
really well.
Okay. What do we think? Better?
Yep, that's exactly what it needed.
Okay. So we're going to be able to put some Vaseline on it, okay? We're going to wipe away the brows now, and I think we're going to be done for today. So we'll stand you up and get some beautiful after pictures of you. Again, the ink is going to look a little darker as it has the Vaseline on, and the blood is all the way up to the surface. So what happens over these next 2 weeks is you wash it as little as possible. No scrubbing, no heavy anything. They do want you to kind of stay out of the gym and don't do major sweating. That's because your body's always trying to eliminate things, and when you're at the gym and you're pouring sweat, we don't want to be pulling some of the ink out of there while it's healing. So if you can go and lightly perspire versus pour sweat, I think that's better. Obviously, don't touch anything at the gym and then touch. We don't want any cooties in there and any infection. and just letting it heal quietly underneath. The often applied Vaseline is the best. No swimming face first. No sticking your face in the shower. Letting the water beat on it while it's healing. You have to do all of that in small stages as it's healing. Okay, you can go ahead and look, honey. See what you think. Better?
Oh, yeah.
So we're just going to lightly go back and forth so that we're getting under the hair. Some people have had healing that got a little scabby under the Vaseline, so I just kind of want to show this. I'll probably wipe it away for her after photo. But when you see that you're going to get it under the hair, that way some people have actually put Vaseline on top of the hair, and then the healing starts underneath and they kind of scab, so you don't want to do that.
Coming in for a touch-up and wanting more is always fine. It's not a problem, you know?
Oh, yeah.
How are we feeling? Good?
Yeah.
Let me see you smile. I want to see your little smile. You're so cute.
All right, so we're gonna go to some of the before and afters, which I think you're gonna have to help me with. Really quickly, the one thing I did want to say, because some people jumped on after we got going, is questions that people had were the microblading is typically done by hand, and the permanent makeup is done with a tool that's plugged into the wall. So some people get a little confused by that. You can do the eyeliner by hand as well. It just really takes a long time and it doesn't last as long. So I don't typically recommend it unless somebody's on a heavy Coumadin or something like that. And medication wise, it might just be too hard to give them a tattoo, but they want some sort of color. So I tend to try to do that a little bit. Where are we here? Okay, so now we're going to do some before and afters. I just hit this little one. Yeah. There we go. Okay, we're going to start. I didn't know if Leslie was going to be first. So this person did not have hardly any eyebrows at all. We talked about the fact that she didn't really want anything crazy. She didn't want people to know that she did it. She wore very light blonde brow pencil. So for her, this was a tiny bit dark, but it does lighten as things get going. Similarly to mine, I tried not to wear a lot of makeup today. Mine is a little bit older. I don't have any powder on there at all. I don't know if you guys can see mine close. I'm trying to get close. But my brows are super blonde. So a lot of times you'll see all of the dark, heavy tattooing. And what's difficult about that is that that's all you see on someone's face. So I try really hard not to do that. Hers also were pretty even before we started. I don't know if she does Botox or not. I can't actually remember, but she really loved them because nobody really knew and that she did it. And she said it looked a lot like what her brows were like before she lost them all, which was really nice. So again, you kind of want to not do the big heavy feather and a big square because sometimes it's just too much for people. I try to keep it softer. This is a good example of how her eyebrows are a little bit uneven. It's one of the reasons I picked her. She could do some Botox, she could do some other things, but again, we want to stay where your brows go. So if I mapped the daylights out of this lady's face, what could happen is if she decided not to do Botox or not to do anything or whatever, one side, because the ocular area will tip, the one side is down a little bit, the brow can continue to get wider and wider. So some people come in and say, I don't understand, my face was measured so perfectly, and now I feel like it's too thick on one side, it's too heavy, I'm having a really big problem. A lot of times that will have to be lasered away, where if you're staying in someone's brow as close as you can, everybody has asymmetry in their face. It's never going to be perfect, and that's okay. That's why we're human. So, you know, if you really want it corrected, you're going to have to do a little bit of Botox on the one side to raise the brow and actually some on the other side to drop it down a little bit. Another nice treatment to raise brows is Ultherapy, which is non-surgical skin tightening. And it can be done to just raise your own tissue naturally without having anything injected. So a lot of people kind of like to complement their Botox with that. So we're going to go to the next one. So she actually wanted her brows a little bit more solid and wanted them a little bit heavier. So again, I did these because they're all really different and they're not like a big Instagram crazy thing. She wore her makeup a lot like this. This was something that she really wanted. She did not have a lot of brows in the front. I'm not sure, more in the front area of this side and this one. So her husband actually, I don't think her family wanted her to do it at first, and then she decided she was going to, and she really, really loved it. She didn't have to do anything to change her brows and things like that, which was really, really nice. So, and it was a really dark color, and it has faded quite a bit because I just saw her the other day and she's thinking of doing it again. And I think this time she actually will do a little bit more in the fronts. But you know, you really have to think about the fact that when you're letting somebody do tons of measuring and tons of mapping, that's fine for the first 2 years, 3 years, something of that nature. But as you do older patients and people aren't 20 and they're not 25 and they don't want to do Botox and things like that, you really kind of need to put somebody's brows where they are. And it may not look like the most perfect Instagram brow, but it looks correct for somebody's face. So if they do want surgery and they do want to do something, we didn't completely change an eyebrow to a big different brow than what they have naturally on their face. This is going to be Leslie, the model that you guys saw worked on. Again, we talked about the fact that if you see on her before side, she has some of those brows that angle down. She has that area on the one side there that was empty. And we really worked on trying to get that as nice as we could. The first time we did Leslie's brows was this was the third time, so several years back. She didn't even do this much. So what's interesting about microblading is everyone thinks like, oh, you know, I probably should do it when I lose more brows. When you look how beautiful, you know, Leslie's brows really are naturally, some people think it's crazy that she does it at all, but because of her lifestyle and the things that she wants to do, she doesn't want the makeup to sweat away. It's just added a really great benefit for her. She does ride with the horses and they put those hats on and they sweat pretty heavily underneath there. She's got a really big, gorgeous horse and spends many hours with him. And then also, like she said, she's outside in the elements. They go to Colorado and Utah and things like that and snowboard. And she's out in the freezing cold for long hours at a time. And she feels like she can, you know, when she takes her little goggles off, she looks normal. She loves the thicker lashes, you know, the eyeliner. We hadn't always done it that thick. She started out more as like a lash enhancement, and as she's gotten a little bit older, she's decided that she wants it a little bit heavier. Another thing I should say is you can also use eyelash growing serum on the eyes. Letitia's one, we have Nucil by Obagi. It's really wonderful. It makes the brows grow. It is non-prescription, so for some people they really like that. And they did just launch a brow growth serum. Looks a lot like a liquid eyeliner. You're just going to paint it on the brows. Basically, you don't want to put any of those products where you don't want hair. So if you're growing along the lash line, in other words, you don't want to come way out from the corner of your eye, or you're going to get a nice little pocket of hair out here that we're going to need to start waxing. So it's just a nice way to kind of add to your own brows if you feel like you've lost hair from either chemo, age, or whatever. If you do start tattooing at a nice young age like this and it fades nicely as the years go by, we know where your brows have always been and we can kind of keep them up. So you're not bringing a picture in and you have 5 eyebrows left and you want this thicker eyebrow. You think you want it until it's tattooed on, and then it can sometimes be almost too big. And the problem is sometimes when they fade, then you've got a giant amount of color that some people end up not liking long term. So these are some pricing. I know somebody asked me about that. Typically the brows start at $600 if you're microblading. I don't go up a ton from there unless we have to do some corrective work. There's some other things that need to be done. If you have absolutely no hair, sometimes it costs a little bit more, and sometimes you're even back 3 times instead of 2. That would be maybe to add some shading as we go along, things like that. So that's the range. And when they're done, they should be done for a year, 2 years, something like that. Some people, the last couple people that inboxed me on the last one said mine have lasted 2.5 years, so which is really good. You got to take care of them. Obviously, I'm a big Obagi person. I love Retin-A, I love hydroquinone. All of those things can lighten your brows. If you're a swimmer and you're in the pool and it's a chlorine pool. There we go. Sorry, when we went offline, it muted me at the same time. Okay, so now we've got another question. Talk about using laser to remove sections of the brows that were poorly done. Yes, you can do that. I do recommend it. You know, I started tattooing in the early 90s. So to be honest, when I first started, everybody had bad color. It was the grays from the 70s and 80s, and it just was what it was. I think that's really where a lot of those lasers came from. They were developed to get rid of some of the bad, scary tattoos. So we do that here. We do it at the Beechwood location. Any of the physicians can do that for you. Depending on how long it's been there, how dark it is, the color that you're going to want, we would need to figure out, you know, what you're really looking for and how much color is there. So, and how many visits that would be. There are certain lasers that will pull that pigment out, and what happens is it can turn kind of funky colors. So sometimes you're going to have to almost camouflage a little bit, but to get the gray out is so beneficial. And what's really awesome about that is that when you re-tattoo, as you saw with Leslie, you're not going to have that dark. Again, like so many people, I feel bad, you know, and they say, well, gosh, if I do this and I laser it away and then I tattoo with you, aren't I going to have that dark gray? Mine are a blonde. I don't have the dark gray. The 23/7 that I referred to is the numbing that we use for the brows. So, it's just what we get from the compounding pharmacy. It's pretty strong. We use it for microneedling. We use it for lasers, things like that. Cannot be used on the eye because it's not ophthalmically okay. So you saw the drops and some of the other product that I used that's for the eyes. And again, I know some of you guys logged on a little bit late, but these are all individually used, bought in the US, not in China. A big deal on the metal and things like that. The tattooing that you saw with Leslie was done by hand, and that is, they're put in little tiny hair strokes that I try to follow your own. And the tattooing needle is done by machine, and it is plugged into the wall. We got a couple more questions, and I'm going to do some more. Oh, I think we're okay. I think we're all right. I don't know if anybody has any other ones. So the color, I am looking into lip blushing. I can't remember if I said that on this call or the last one. It's just a little bit different of a technique with a different wand. And so basically, I think it's a little easier for people to have done. It's a little quicker. The company that I use actually makes a new handpiece. I just need to look into grabbing that. The needles are also going to be obviously individually wrapped, and one per patient, one per visit. And it's going to be a little bit faster for you to have done. My question to them is going to be, does that mean that it's going to be more superficial? If that's the case, you might kind of want to go with the old tattooing and just get your lips tattooed and leave it. It's easy to do. I usually don't do a lot of the injection numbing because what happens with that is your face swells a little asymmetrical. So we just use a lot of the topical numbing. So it looks like I don't have any other questions. I don't know, Nina, if I need to go to the next. Approximately how long does the brows and liner last? So if you're going to do the brows with what you saw with Leslie, it's anywhere from a year to 2.5. I know that's a wide range, but the reason for that is how it's taken care of. If you're in a lot of sun, if you're in salt water, if you're swimming face first, things like that, it's going to make it come out. When you're doing it light like this, it doesn't last as long. I have mine a little bit lighter simply because typically I darken the hairs that I have. I don't have a ton of hairs. So that way you can at least see and my face isn't washed totally away. It just depends really on how it's taken care of and how it stays. But I do know that what's nice about it is when it fades, you kind of want it to, because when people come in and they have old tattoos that have been there a long time, they're really upset about them, and they've been in the skin for just far too long, and they're not beautiful anymore. So it's really good if they fade away to you needing it to get done again versus they faded and now you need to laser it away. If you do it with me and you have it lasered away, you will not need to do that again, which is really good. I mean, if there's a spot that you feel that's bugging you, then you could do that, but you wouldn't be lasering the entire brow. So I think that is a very good thing. Let me see, I've got some more coming in here. Approximately how long? Okay. And the liner's longer because the liner is put in with the layering of the tool. So the next step to make an appointment, someone is asking, is for the application. So basically what you're going to want to do, if I touch this bar, can it go to the next screen so they can see it? Yeah, because I know so it's Jill G at the Parker Clinic. Let's see if I can, there we go. You can see it there. So it's Jill G at the Parker Clinic, and then that's our phone number. I do it at all 3 locations. So you can do a consult online if you would like. You cannot, can you see me still? I think. Okay. Okay. We can do it this way. So I can do it FaceTime if you live far away. I know some people are logging on from different areas of the country and they're going to be in town, things like that. And they want to get it done when they're here. That's fine. If you're not getting the appointment that you want, just email me and say, this is my flight. This is when I'm coming. I do have some days off that I'll probably end up opening for some of this because my schedule's already pretty full without all of you guys. So I'm going to work with people as best as I can. Healing, let's see, what's this question? The email and the phone, couldn't see. So email is going to be jillg@theparkerclinic.com, and then the phone is 216-464-7333. That is our normal line. And then again, we can via FaceTime your consult if you want, if that will help people with timing. And no, you don't want to stop exfoliating and stop using tretinoin and hydroquinone. You know, I'm an Obagi lover for sure. What I normally have you guys do is buy those little cheap Vaseline. They're like up at the front of CVS or something with a little red lid, and just sort of throw some Vaseline on. It will make a barrier so that you're not bleaching and lifting and taking your brows away. It's kind of a pain, but you know, it's just something that you need to do. A lot of people will say, well, I put my Retin-A and my hydroquinone on my forehead, but I don't put it on my brows. The products are going to want to migrate, especially in the evening. Heat comes out of your eye sockets when you're under your blankets at night, and your products tend to head towards the lashes a little bit. So it would end up lightening the brows. So we just kind of have to try to prevent that. So that was a very good question. Can anybody think of anything else that I didn't say? There was a question. The cost of the consult typically is $75, and we're waiving that for this. They may end up, I don't want to say the front desk does things and I'm not in control of that. They have their rules and we have to let them follow them. So all that means is if they say you have to pay $75, it's so that they know that you're going to come. So let's say you say, Jill, I don't want to do this. It's not for me. We would let you buy a product. You could see Dr. Parker, whoever you normally see here at the practice. Worst case scenario, we could give your money back. I did have a sweet little lady come one time. Medically, she just couldn't do it. She was a little bit older. There were some issues, and I just gave her money back. You know, there wasn't anything else that she wanted. So we're going to hold you down to it. Just basically, we know that then you're coming, you're going to see me and things like that. Do you need a consultation first? You really don't. You saw this, you know what you want. You're going to numb for 30 minutes. So if I've never met you and I don't know you at all, when you're scheduling, what I would say, if you can remember this for me, is basically, I'm going to need to do your consult while you're numbing. Typically, an assistant of mine will grab you, they'll numb you, and then I work on you for about an hour and a half. I would use that 30 minutes to consult you. I don't always do it that way, but I can, since you guys saw it and you know you want it. And there really aren't a lot of people that aren't candidates for it. If you are using any eyelash growing serums, brow growing serums, stop for about 30 days prior to coming. It just keeps it really vascular. And you'll bruise a little more and things of that nature. So any other questions we can think of? Or again, too, the other thing is while you're healing, you want to really make sure if you've got nice brows like Leslie, you want to make sure you're getting that Vaseline through onto the skin. We don't want to kind of softly put it over top of the hair and let that tattoo heal at the bottom. It's going to end up pulling the color out and things like that. So we go over a lot of those things when you're here, but anybody who takes care of it really well has a lot of really nice longevity. And typically what my patients say when they come back to me is, you know, all of a sudden I realized I needed a brow pencil and I thought, nope, I'm not going to do that. I'm just going to go back and see Jill. I don't want to have to deal with that. So that's kind of really all the complaints that I typically get. So hopefully I was able to answer everything. If you guys are worried about anything else, I see most of you, I think. You can email at any time. Obviously, consults are great because then you're sitting in front of me and we can really talk, you know, easily. And if that is difficult for your schedule with mine, then we'll try the FaceTime visit. I can just go in a room privately like this and talk to you that way. So that would also be a way that you can just schedule and also get a consult in before you came. So that might be another easy way. Anything else anyone else can think of? You seeing anything else? I think we're good. So I want to thank you guys again. I really appreciate everybody giving time out of their evening and their daytime and all of that to attend these with me. I really appreciate when you guys tell your friends and always, you know, are so good to us and come and see us at the clinic. We do this at all 3 locations. You can do it in Willoughby, Westlake, and Beechwood. I am in Beechwood the most. I'm in Westlake 2 Mondays a month with Dr. Parker, and then I am in, with Dr. Parker 2 Tuesdays a month in Willoughby. So all of these procedures can be done there, and she can take care of your Botox at those locations as well. So thank you very much. I hope you guys have an awesome evening with your family, and I hope to see all of you guys soon. Thanks for tuning in.